Now to our health check. A growing problem with drug abuse has exploded on the streets of San Francisco.
Crack I take, but speed I just can't not do it. If I don't do it, I find myself in a black hole all the time.
The city is seeing a surge in the use of methamphetamine. Many users turn to meth because it's relatively cheap and easy to find. A new task force report that examines the increase in methamphetamine use finds arrests for possession of methamphetamine increased from 19% last year to 21% this year. That is far from the most bewildering statistic. Let's talk about this more. We welcome to the 9 Dr. Marlene Martin from Zuckerberg San Francisco General Hospital to talk about your hospital's Addiction Care Team, or ACT. Good morning, and thanks for being with us.
Good morning. Thank you for having me here.
You take your work onto the streets of San Francisco. Tell me what you see.
Yes. Well, our San Francisco General is the safety net hospital for San Francisco, and we take care of anyone who walks through the door, including many patients who use drugs. We are seeing the patients who are coming from the streets, people coming from other places, housed or unhoused, and we bring addiction care to the bedside with an interdisciplinary team.
Meth was around, I think, when I was in high school, right, back in the 90s. How is today's meth different, and why is it so deadly?
Yeah, I think that's what we're trying to figure out. We know it's a lot stronger than what we had before, and we also know that more people are using meth. We don't necessarily know why, but it's really sending the body into overdrive, and we see older people who are using meth and dying of just with meth in their system. We see that they're having heart attacks, cardiac arrest, they're having strokes, and we see young people who are using meth, but those people who are overdosing and dying also have opioids in their system. Things like fentanyl and heroin, and we think that that is causing respiratory distress and leading to those deaths.
How do you treat someone who is on methamphetamine and also likely has a host of other health or mental problems along with it?
That's such a great question. You know, in the hospital, we have the opportunity to meet people where they're at, to talk to them, to find out why they use, how they started using, to get the story and the human behind the person and the disease. This is a patient with a long history, and many other things are not defined by their substance use. So we figure out what they want, and we really aim to reduce the harms from drug use, whether that means people want to cut back, they want to use more safely, they want to stop using altogether. There's a couple of medications that are not FDA approved to treat methamphetamine use disorder. So we can initiate some of those, and they work a little bit for a group of people. And then we also have things like residential treatment, where people can leave the hospital and go, but then also focusing on other programs that are evidence-based, like contingency management, which insurances don't pay for.
What is contingency management?
It means that we incentivize people to not use.
As long as you stay clean, you'll keep getting X.
Yeah, if people come back and they're not using, or they show up to their appointment, usually they have to do a urine toxicology screen, and if that is negative, then they will be able, usually a financial award.
What do you say to those families who are heartbroken by either the loss of their loved one due to methamphetamine, or they're actively watching someone take their own life away slowly?
It's so hard. This disease affects not just the individual, but also all the family members and the people around that person, and it can be hard, but there are so many things that we can do. And I think the one thing that I always stress is people are using for so many different reasons, and we can help address those reasons over time. And we really have to figure out, let the individual tell us how it is that we can help, and how it is that they want help, and have an array of services that we can offer.
Not everyone responds to people who are addicted to methamphetamine with compassion. I have seen and read disgust, frustration. What do you tell those of us who might be frustrated over what's happening?
Yeah. I understand it. I think we see people, we see a multitude of stories, right, of people who use methamphetamine and or other drugs. And you know what I tell what I say again is really understand the narrative, understand why, try to have compassion and curiosity for the story, to imagine what may have led to the drug use, to the meth use. And I think that opens up space, patience, and compassion.
Everyone is a person before they're an addict.
Everyone is a person, and they're not defined by their disease.
Dr. Martin, thank you so much for joining us.
Thank you for having me.
Mike and Sal.